New Health Secretary's in-tray has been hit with another rise in NHS waiting lists in England. 6.33 million people were waiting for routine hospital treatment at the end of April. In May, it reached 6.38 million. Well, over 300,000 had been waiting over a year for treatment at the end of April. A month later, and it also risen to 307,000. But there was a fall in those waiting more than 18 months. There were just over 5,000 people on the list in April, falling to 4,600 by the end of May. Here's our health correspondent Rebecca Barry on how the NHS is trying to tackle the problem.
So over the next few minutes you might start to feel a bit sleepier.
David was one of the millions of people waiting for surgery on the NHS in England. But in a couple of hours he'll have 2 new knees, and in a couple of days he should be back home. We're at the South West London Elective Orthopaedic Centre in Epsom, a surgical hub run by 4 local NHS trusts. Because they're a specialist unit dedicated to orthopaedics, things like hip and knee replacements, they work incredibly efficiently, meaning waiting times here are well below the national average.
They're not having to fight for spaces with patients who are in for emergency procedures. They're not going to get their surgery cancelled on the day because there isn't a bed available. The anaesthetic techniques that we use mean that we can get patients walking and moving much quicker.
Cutting the waiting list in England, which as of today stands at 7.6 million, is a priority for the government, and they've backed plans for more hubs like this. They have 6 operating theatres like this here, with staff working 6 days a week. It means they can perform 6,000 procedures a year, and a quarter of their hip and knee patients go home the same day.
So walk up to the step for me.
So I've been having falls, and I broke a finger and I've got bruises all over the place.
That's it, well done.
76-year-old Anne had replacement knee surgery yesterday and is going home today.
It's just so efficient, really efficient. You know, you're told in advance what's going to happen and then what's going to happen afterwards as well.
And now you're all set to go home?
Oh, yes. Hoping that somebody will cook me a meal at some stage.
So when patient goes home, they have access to an electronic diary.
They cut the need for follow-up appointments with consultants by monitoring patients at home through video diaries.
So this patient, for example, doesn't need to come to the hospital. So we free up the consultant slots. So consultant can see new patients.
At home you would do...
From immediate physio to the right painkillers, it's all about getting patients swiftly through the system.
They are more comfortable in their own home, eating their own food, sleeping in their own bed. They're likely to be more rested and recover quicker.
Labour want more evening and weekend working as they do here, but many say NHS staff are already stretched.
You could potentially be counterproductive if you stop people from having the energy and resilience to carry on.
There are more than 90 hubs like this across England, with more planned. But some say the immediate priority for the new government to cut waiting lists should be ending the junior doctors' strikes. Rebecca Barry, ITV News, Epsom.